Oh my goodness. Jeremy, Luis, so serious, but we're going to actually make sure that it's not.
Yeah.
So thank you very much for coming. So let me just set out the scene. First of all, welcome to the business pitch. Come for the insight, stay for the chat. Catchy, huh?
Yeah, love it.
Really catchy. Obviously, as clients of Hunter AI, that's not the focus. What is the key focus is that we actually want to hear from two very progressive supply chain subject matter experts. But perhaps even more important is that you guys are independent business leaders and offer a lot more value than just supply chain. So that's really what we want to try and explore from a leader and beyond perspective. And also, you know, you are asked so many questions with regards to what you have to do, what decisions you need to try and make. We want to try and make the audience aware of your thought process that goes behind it. So as a introduction, I'm really proud to actually have you both here. I've got Luis, I've got Jeremy. Luis is the supply chain head of Christiana Care with a huge background with regards to procurement, many, many years associated with this. Jeremy, I didn't realize you was a lifer at Rush.
Yeah, it's been a long time.
System chief, vice president, supply chain as well. And from that perspective, you guys will have lots of opportunity to, talk about your experience and everything that comes with, the decision making. So super pleased that you're both here.
Awesome.
Yeah.
Fantastic.
Yeah.
It's what you have to do, what decisions you need to try and make. We want to try and make the audience aware of your thought process that goes behind it. So, format, just to actually let you know, this is not just a one-off podcast. It's not just a one and done deal. We want to try and make this as continuous as possible, because as business, as we know, it's not just static. It's always going to be continuous. You're going to be confronted with different problems. You're going to have different sorts of situations. Your decisions and everything like that is going to change. So as we progress over, let's say, the course of a year, it'll be interesting just to see how your perspectives changes and, what some of your decisions that you might come back on, move forward on, and be more aggressive on, okay? So regardless, with regards to this, we want to try and get the people and the audience excited. So I picked two great people to actually do that. And we want to attract, a lot of new existing healthcare professionals that are going to look at this. And so we want to try and make it very, very quick, chatty, conversational. And from that perspective as well, we want to try and make it as interesting, for the audience as possible. So format from this viewpoint, going to make no apologies, and nor should you, because you're going to be on a regular basis. The harsh reality, we'll make statements, we'll make some comments, we won't apologise with regards to what's actually happening, because in conversation and business, you're not going to get everything 100% right. So don't feel that you've got to massage this.
Okay.
The key thing about this as well, so that the audience actually understands, there is no script. You haven't been prompted.
Not at all.
Not at all.
At all. You have no idea.
In fact, I asked for prompted together.
We're paying attention very closely
Yeah.
to what's next. Yeah.
Well, you might have actually seen that there's a clock on the back here, and the reality is I'm basing this format on the rugby sevens. For those that don't know rugby, look it up. But literally, there is 7-minute halves, and you've got 7 minutes where we'll just have a conversation, and I'll bring up a topic, and we'll just debate it and discuss it. You hear all these other sort of fireside chats where, one person builds off the other. The whole premise of this is that you're not going to build it off. We're going to get your original thought. We're going to get your original thought.
Yeah.
Okay. The red cup has actually reappeared, Jeremy.
I know.
I tell you, it's starting to get really interesting now. So the first question is, the introduction is the margin paradox that we actually talked about. You're always looking on procurement in traditional areas to reduce costs, while AI suggests new perspectives and opportunity to reduce costs. So first pain point that we actually want to try and discuss and get your points of view on is human teams cannot keep up with the massive data sets that are there. What happens in your team, and what's the view with regards to what are they doing there?
As far as data sets?
Yeah,
Yeah.
to help you with your business.
Yeah, absolutely. No, data is a huge problem in healthcare because it's so disparate, and it's not, a lot of people get worried it's not clean, just because so many different avenues, not a lot of standardization. So my team does focus a lot on data consolidation, data cleanliness, getting that data clean from all of our sites, kind of standardizing it. And then when you think about it, because obviously if you want to do automation, you do have to have some of that.
Yeah.
But we have used tools. You can use automation sometimes to help you with data cleansing. So we've done some of that as well, which has helped a lot. So yeah, we spend a lot of time doing that.
Yeah. So, you know, the main reason why we're actually saying this is when you actually think about the overall view of trying to actually reduce costs, and effectively, you know, when you look at your cost structure that you're managing, it's huge, right?
Yeah.
And as a percentage of revenue for Rush, I asked the same question to Luis. You know, your costs are what as a percentage of revenue?
The overall cost that I oversee?
Yeah.
Like manage,
yeah.
As a percentage of revenue, it is about 50%. Like it's not quite. So you have labor, and then you have all the other costs. Yeah. Labor's slightly above all the costs that we manage. So but it's close to when you think of all the pharmacy costs, all the supply costs, all the purchase service costs. Yeah, that's a big number.
But the challenge that I always have is like everyone's focused on the patient. Everyone's focused on, you know, innovation at the front end. All the money and innovation's actually going into here. So my point is around this is, you know, trying to get a number of FTEs to actually support managing 50% of your net patient revenue. Do you struggle with regard to
the investment in supply chain to do that? Absolutely, yes.
But why? You know,
it's
Dr. Latif to me is, you know, one of the most inspirational sort of guys and gets this.
Yeah, I think it's just historic, right? And supply chain in healthcare has always been underinvested. So, and then obviously the cost pressures overall for health systems, like they've grown up over decades, right? And in the past decades, they haven't spent a lot in supply chain. So it's always behind, but then to bring it up to speed is always a challenge because you already have all these other things. It means there's not any extra margin to take out and say we're going to allocate there. So
is it disproportionate though? Do you feel, you know, from a viewpoint
it is disproportionate,
you know, because, you know, I look at some of these supply chain heads and the number of people that they've got managing billions of dollars of
small number.
Yeah. But all the other money's actually been pushed out to front end, and you're trying to serve as many patients as you possibly can. But then at the back end, the number of people, you know, you're asked to reduce costs, asked to reduce the number of FTEs, be more efficient. But the costs and the amount that you're actually managing is going up, and the pressure's going up.
Yeah, and I think it is that paradox of understanding that investing in that actually will equal greater cost reduction, right? That's part of the sales pitch. I will say there's also that paradox of with technology coming in, do we need to keep just adding people to do all of that? Because that's a healthcare norm, but I think healthcare's like any industry starting to look at it. Do we just throw more people at all of this, or do we need to be smarter, wiser about how we tackle this?
Right.
So there's hesitation because we're already like the healthcare industry. We're a people business, right? We manage it through people, so it's always talking about how can we reduce labor, to keep labor in check. So adding more is always a hesitation. So
a massive hesitation, right? Because you know, ultimately, you know, everyone looks at reducing your administration costs, and you know, they're looking at organizations.
Yeah, they do. They look at the corporate areas because they consider them overhead, all those things.
Yeah, and the importance of it. But the amount of new data that's actually coming in, what do you do with that, if any? You know, you're talking about putting new tools in, but still in the traditional way, lots of people are still using spreadsheets.
Yeah, what do I do for handling data? I use AI in a lot of ways. And we centralize it, so when you think of different data, you do have different streams. You have to get your arms around all of it, like your contracting data, getting a contracting system, getting your...
You feel you got that under control from that viewpoint?
I do. Yeah. It's taken a little bit, but I do think we've gotten it under control.
Yeah. What's been the secret of your success with regards to trying to actually get that under control?
Yeah, it is essentially getting buy-in from the entire organization that we're going to funnel everything into a single channel,
right?
and that all essentially putting rules in place that if any contract that gets signed has to go through that channel, through that review process.
And if they don't?
And if it doesn't, then we have an audit process to go back and find those that did it, and then we put them in anyway.
Yeah.
And then flag that and have that discussion with the leadership. Will have that discussion with that person.
Are you looking at you know, the amounts of data and the layers of new data? Are you recording that in any way to actually just say, hey, what else can I actually do with that additional?
Data is power. So getting our hands around as much data as possible. Like contracting is one because that tells you a lot of the story where your spend's going. If you can't sync all of your spend to that contract, but then also getting visibility all the inventory levels, all that extra spend that's happening. The more you can get your arms around, the more impact you have.
Yeah.
Because data is power. But harnessing that data and turning it to information is always that's the bigger challenge.
But I know, you know, because we only got 20 seconds, but you've really incorporated a real fresh team to actually look at that.
Yes.
Because, you know, speak to that just with regards to 10 seconds, because I think that's also critical, because, you know, procurement is typically not a lot of fresh people.
Yeah, I've intentionally hired people in that space that aren't just,
I took too much time, but yeah. Okay.
You said 10 seconds and you didn't give me 10 seconds.
Okay, you carry on just for the last 10 seconds.
All right. Hiring people in that space that are critical thinkers, that are innovative thinkers, regardless of their background. I don't need necessarily procurement people, supply chain lifer people. I want people, they can learn those things, but they have that sharp mindset of being innovative, critical thinking. We want them on that team.
Okay, fantastic. You make sure that they can distinguish between who's actually got the cleanest beard cut between you and Louise. You both are very clean with regards to that. So the question number 2, pain point 2. Fragmented data kills margin recovery. Unstructured data from multiple data sources, traditional data models slow the process down and provide no context. The positioning implication, labor intensive for procurement to get the right answer quickly. Traditional procurement, gather the data, analyze the data, discover the outcome to be positioned, and then do the implementation. AI, on the other hand, absorb the data, produce the outcome.
Yep.
Okay, so fragmented data kills margin recovery. What's your perspective with regards to that?
Yeah, it does. Yeah, it can. Fragmented.
Do you measure it?
Do we measure how the impact of it?
Yeah.
No, I don't think we measure it, but it's definitely a barrier, right? Fragmented data slows things down, speed to value, all those things. Because you have your analysts have to take time just to clean it, make sense of it, versus just react and act upon it.
Yeah. But how do you actually feel from your perspective when you're trying to justify, let's say, new equipment, price comparisons? Everyone talks about value, value care, value-based analysis. When you actually have all that fragmented data and you're trying to actually come together and get to a decision-making point, how do you start to, let's say, maneuver all of that, and especially when you've got physician preference versus, let's say, supply chain recommendations?
And what do you mean maneuver it? What do you?
In my view, maneuver, let's say, the outcome to what you want to actually achieve, because ultimately your goal to actually save money. The physician is goal to achieve the best outcome for the patient.
Yeah, and then it's the best outcome. It's also at academic centers, it's the research. So, like, there are different agendas, development deals that they have, all those types of things.
Yeah.
So how do we align those things?
Yeah.
At conversation, actually. I think, and I teach my team this all the time, you need to engage the clinician teams and whatever the stakeholder. If it's marketing, we're working marketing and marketing contracts. We don't know marketing world.
Yeah.
But we do know how to standardize, how to make deals where possible, right? Engaging them to understand what their agendas are, because you just mentioned it, the agendas aren't aligned.
Yeah.
But it doesn't mean they're fully disaligned. Physicians also want to save money to reach more patients and to have better access, to invest in their program, invest in their tools that they use. But you got to understand, if you're just saying, I want you to standardize to this, but that's an opposite of like his research development that he's being asked to do as well.
Yeah.
Like you're not.
It's a bit of a contradiction, right?
Yeah, it's a bit of a contradiction, but you can find alignment in there. So it's finding those where the lines intersect, and they're not perfect.
No, they're not perfect. But one of the cool examples that I speak to supply chain heads, and they come up and say, trying to actually get a clinical, let's say, decision on supply chain is like pulling teeth, because you might have a value-based care committee where some physicians are representing, let's say, the decision-making process, but there are also a small number of people representing a large number of physicians. And so the length of time to get that decision, and even once you've got the decision, how to actually monitor that it is actually being followed.
Well, and that's where I don't, we have value analysis teams, but we engage the physicians directly. So not just their leader, but you go to, because not always the leader is not always the highest volume guy.
Yep.
You
But talking to a supply chain person, though, sometimes?
Yeah. Why not? Like, why? Because we're trying to help the business improve. They're trying to move their part of the business. Sometimes we can align. Sometimes there's strategies. They're like, I need access to this equipment. I see that as the game changer potentially. Well, I can help you get there, but you got to help me save money to get there, and we can make the argument together. And we can add that asset, add that program without incrementally adding costs to it. But you got to help me figure that out.
Yeah.
Aligning with them, like I said, it's aligning with them where it makes sense versus just fighting with them, like standardize and like, no, I can't because I got to do this. It's finding those intersections
but do you
and
find
having those discussions.
Yeah, but because I looked at your background, and your background is pretty impressive with regards to where you've come from. So you're not your standard procurement person.
True.
Okay.
I'm used to engaging physicians.
Yeah.
Yes.
So obviously a huge advantage.
I do think it's an advantage, but I also think it's a skill set that can be learned. I don't do it as much anymore. My team does that, and they didn't have that experience.
So how did you pass that on, and because I think that's quite critical.
Yeah.
Because I see some other people, especially if you talk about smaller hospital systems that don't have that capacity.
Yeah, there's that. There's always that nervousness of talking to the physician, right? Because they're the all-star that's bringing in all the patients. But I think
or saving the patient.
And saving the patient, yes. They're doing all of that. Our systems revolve around them. How I taught it is I would do it with them, have those discussions, and just say, hey, we do need to have these discussions, listening, actively listening, not just pushing the agenda that you have, actively listening for what their agendas are, trying to be strategic, figuring out where there's potential intersections that we can align those agendas, and looking for those, and then start talking and engaging them in that way.
Is that more thinking on a
I think that's
business?
strategic sourcing. Like, that's strategic sourcing.
Or strategic thinking as well.
But we say strategic sourcing, but strategic sourcing isn't just go to one or two vendors or else. That's not strategic when you think of, you mentioned it, we have all these other agendas that they're trying to hit. They're trying to do what's best for the patient. They're trying to do what's best for finding the next greatest thing to make a breakthrough to help patients and save more patients, right? And they're also doing those things. Actually, our health systems are also want them to do those things, not just save money. But we also need to do both things. So how do we do that? And then when you engage them that way, they open up to you very differently.
Yeah. But physicians are unique individuals, and individuals in the nicest way. How do you, let's say, try and normalize that? Because one person can't be everything to all phisians, and then obviously all physicians are. Wow.
Going really fast.
Yeah, it has gone really fast.
I don't think that was 7 minutes.
I won't even give you an opportunity to actually respond. But just quickly,
So you are going to give me an opportunity to respond.
I am, because I was actually speaking too much, and that's not the rule of the game. Yes. So what's your view there, just quickly?
Of which, remind me the question now.
The question is, how do you get your, let's say, your team to actually go across multiple number of physicians to actually get the right answer?
Yeah, it is talking to them. It's talking to, obviously there's also hierarchies in physicians, right? Like you have the ones that are learning from the more seasoned ones, all those things, they help drive some of the decisions of what they're going to use, those guys are going to use, and figuring out who those key levers are and talking to them first, getting them aligned, and then taking it through. Okay. So, but all physicians they're just like all people are different too, but they all engage they all have the same thing at the center of them. They want to figure out how to help.
Yeah.
But they just they want to do it in a way that also helps them, not just is at an adversarial position to what they're trying to do.
Yeah. Perfect.
Yeah.
Perfect. Pain point 3. Leakage is continuous. Avoidance must be continuous. Until you get avoidance under control and monitored constantly, you have to always go back to the recovery stage.
Mm-hmm.
What's your view with regards to how to actually control, the leakage from that viewpoint? And then, we had an interesting conversation just before you with Luis about, avoidance is not necessarily as high on the agenda, for the executives.
Mm-hmm.
Because, you got to just pay what is actually being contracted.
Right.
Yeah.
Yeah, they always look at it from what our current spend is. And
Yeah.
How do you make it less? Not.
Yeah.
You avoided making it more, right? So that is true.
Yeah.
But as far as leakage, as far as like putting new contracts in place or a new initiative in place that you're going to save money, how do you maintain that?
Yeah.
Essentially.
Yeah. And one,
Yeah.
like I say, it's continuous, but then how do you actually get this under control? The nice reality about leakage is it runs. You think that you're going to come back and you're going to, come back in the next 3 years. You're going to try and recover it, come back. It's just continuous.
Yeah, it is continuous. Almost as soon as you put a new initiative in place, it starts leaking.
Yeah.
I mean, that's the reality, right?
Mm.
That is a challenge that we have. We do try to focus on. We haven't, honestly, we haven't figured that one out, like how to solve that one. Everybody struggles with that because you put let's say you put a new structure in place for spine contracts.
Yeah.
You have it. You come back 3 years to renegotiate, and all of a sudden you've got 15 more that you didn't even like. All these other vendors now are involved. That we just dramatically increased, and did we control all those? And they ate some of that savings that we originally thought, right? That's where that data management comes into play, and getting better and better at monitoring that. Like once you put an initiative in place, like let's keep an eye on it to make sure that spend is staying in the channels we thought it was. We're getting better in trying to do that with cleaner data, and funneling it through, sources that all funnel in the same channels, and like reviewing it and having it categorized and having those category managers look at it in a way that says, here's my spend, it should still be these guys, and now these guys are sneaking in and looking at it. Well, I got to assess that and see what's going on. So we're getting better, but we haven't mastered it at all.
Yeah.
So,
but that's a key challenge,
it
right?
is.
Because like you say, you have a category manager.
Yeah.
You think the responsibility is, hey, you're looking after this. But, I always struggle when you look at the number of vendors you've got.
Yes.
And then, the number of vendors you bring on every month is quite outstanding, because obviously I've just done your recent review of your data. So
it's unfortunate.
Yeah, well, it's
reality of business and healthcare, because you have so many different types of surgeries, types of clinical care going on, growing all the time. So that is a challenge.
Yeah, but the leakage with regards to control against the contract, with regards to the data that's actually there.
Like, are we making sure we pay the price that we actually said?
One is that, and then the other commercial terms that might be there. We talk about rebates, we talk about payment terms, we talk about all these other things that are associated. But like you say, leakage going into, let's say, other vendors that are eating into that particular contract.
But you're right. There's also the leakage of, are we continuing to pay the price that we agreed to? Are we getting the rebates that we agreed to? Or are we just off, and we could have leveraged that if we've been aware and made sure we hit those milestones?
Yeah.
I think there's also pieces where there is leakage that you just don't even realize you missed it, right? Like it's you paid for services you didn't ever agree to, or you paid for freight when it's supposed to be in the contract. All those little things that get slid through.
And is that because, once again, the copious amounts of data?
It is the copious amounts of data that need to be analyzed with that. You can't do it manually and do it effectively. So that is part of the challenge. So there's all those little things that come through, and you have to constantly go back and clean up, and it's always amazing how much there is to clean up when you go back to clean it up.
Yeah. Because the sudden realization that you bring in consultants and they look at the last 3 years and then come up with this marvelous savings opportunity. For you, and how you actually try and control that.
Well, yeah, and I think you got me thinking too, leakage, and one of the things we found with using your tool is we have a lot of basically credits, right? So you find some of those leakage opportunities, like, hey, you overcharged us, boom, they give you a credit. And those credits just sit on their accounts. And we're not taking advantage of them and pulling them into ours, putting them in our letter of treasury, take advantage of those. And there's a fairly decent amount of money when you have that many transactions, and even as you get better at catching them, which we've gotten better, and we did a decent job, as you know, but we still had it still wasn't sitting in our bank accounts. It was sitting in other people's bank accounts that we were just letting sit there, right? So, like, how do we now find the leakage and actually make that leakage valuable to us, solving that?
But that is an interesting, situation there. When you've actually put in the tools to actually try and manage, let's say, one part of the problem, which is, for example, invoice duplications, got that under control. But then, to your point, the discovery is, well, actually, credits is something else that's there.
Yeah, it's just there, and we got them to give us their money back, but not really.
It's
still sitting. Not yet, anyway, right? It's slowly coming back, but they're taking advantage of being able to earn interest and keeping that cash in their bank account instead of ours. So,
But does the leadership look at that from this is a go-to sort of situation that we must look after?
Does leadership look at it? I think leadership is more open to looking at any avenue to bring value to the organization, right? So, yes, when you say, like, there's millions of dollars that we could move here into here, there is some serious, like, let's do that. And let's get a hold of that and create a process for that. So I do think that that's true. And I think leadership is getting more open, and healthcare is getting more open to thinking of, there's all these other avenues. Like, we can do the traditional methods, ways of capturing, but then there's all these other little pieces eating away at it all the time that we may not be capturing and getting our arms around and controlling, that actually eat away at the value we thought we added. So,
well, that's always the problem, isn't it? With regards to procurement, we come up with this business case, but did we realize the business case?
Yes, we always think we do, but we never fully did.
Perfect.
Yep.